So, hi, Becky,
Hi.
and thanks for joining us.
All
So,
right.
first of all, would you like to introduce yourself and tell us a bit about Asist and your role there?
Okay, so my name is Becky Banks. I've worked for Asist for 20 years. I was initially an advocate and now I've moved up to team leader and now I'm the Staffordshire Service Manager. I came to advocacy at Assist as a volunteer when my children were little, and kind of moved up in the kind of way of going to part-time, full-time. Assist is an organisation that provides advocacy. Initially, when I started, we did what was called generic advocacy. So we would support people with lots of different things. We supported people very much around anything that was going on with their lives. So if they had a disability or a significant inability to be able to be participating in whatever was happening, we would be supporting them. So that might have been back then around parental advocacy, so supporting them through the courts. It might have been something as simple as a partner dying and supporting them through going to solicitor and things like that. We went to lots of meetings with doctors, lots of meetings with solicitors, everything we supported with at that point, lots of benefit support and things like that. We don't do all that now. So what happened is that legislation changed, and when legislation changed, statutory advocacy became the norm, and eventually that was all sidelined as generic, and we now do what's called statutory. So that's on advocacy under the Care Act, it's advocacy under the Mental Health Act, Mental Capacity Act, and we support with NHS complaints. We have two branches, so we cover all of Staffordshire and we cover all of Stoke-on-Trent. Stoke-on-Trent also has parental advocacy and children's advocacy. So that's supporting children through SENS, through looked after children reviews, things like that, and supporting parents through the courts if they're going through child protection or child in need. With kind of statutory advocacy, what we now do is support people through things like care act assessments and things like that. So care act assessments are something anyone can ask for if they've got difficulties in being part of society, I guess. So if they need support for whatever reasons, maybe it's because they've become elderly or unwell, they might need a care act assessment, and if they're not able to participate in that on their own, or find it difficult, and difficulty doesn't necessarily mean they can't talk or anything like that, but it does mean that they might struggle to understand things, and our job is really to help explain that and help them to be fully a participant in anything or any decisions around their life.